Welcome back to East Texas Live on KETK. Well, joining us now is Dr. O'Halloran from Mother Francis Center for Cosmetic Surgery, and today she's going to talk about their mommy makeovers. Hello.
Hi.
Welcome. Okay, so you were explaining this to me earlier. What is this term? What is this then?
Well, the mommy makeover is a term that's popular to describe a group of operations that we typically do for women who either have gone through the body changes of childbearing or have lost a lot of weight. We use it for that also. And you know, with Mother's Day coming up, the childbearing process and having kids is such a wonderful, beautiful experience, but it can really have devastating effects on the female body. And so this group of operations is typically done to restore breast rejuvenation, abdominal contour after the changes that happen with pregnancy and childbearing.
Yeah, definitely. So what are some of those specific things that you offer? Procedures, I guess.
Right. So for this population of patients, typically we're doing a tummy tuck or an abdominoplasty to restore not only the contour of the abdomen, but the muscle strength in the abdominal wall. And then also with breast rejuvenation, a lot of women need a lift, and some patients also need implants to restore volume that's lost after breastfeeding.
Yeah, and so how long is that recovery time, I guess? Or how do you know first if you're a good candidate for that, and then how long does it take to recover if you have that surgery?
Right. Well, safety is always my first concern in looking at patients who need this kind of surgery. And so you have to be healthy, you have to be kind of fit and in shape. The things that happen after pregnancy are really changes that happen that you can't fix with diet and exercise. So I really like to see patients who have gotten their body back in order, they're eating right, they're exercising, they're doing the things that they need to do, but the skin won't contract, it won't come back, they've got stretch marks and loose hanging skin. And so those are the patients that are the best candidates, that are already have a healthy lifestyle, but can't quite fix the things that have been damaged by pregnancy and childbearing.
Okay, and then for the recovery time for that after you've had that procedure.
Right, so the first week is the hardest, obviously, and most of these women have little children at home, and so I recommend that they have a lot of help the first week, 10 days after surgery, because they won't be able to do the child care that they're used to doing the first week or two. But after that, they can kind of resume normal activity, no strenuous activity for about 6 weeks. And then for those moms out there who work, I usually recommend that they take about 2 weeks off.
Yeah, well, what would you say is the benefit in all of this then?
Well, the first benefit would be obviously getting your body back in shape and restoring what your body looked like before you had kids, so that clothes fit better, you feel more confident in bathing suits and that kind of thing. But the other thing that helps, particularly with the abdominal wall, is with pregnancy, not only does the skin get stretched out, but the muscles get spread apart too, and those don't ever come back to the midline. And so when we're doing a tummy tuck operation, it's not just taking out the loose skin, but also repairing the muscle strength in the abdominal wall. Yeah,
definitely. Okay, and so as far as people scheduling this, I mean, how is that process, I guess? How does that work?
Well, first they come in for a consultation, and we would look and see their medical history. Are you a good candidate? Can you take the time off that's required for recovery? And we talk about the surgery and what that particular patient needs or feels is important to them. Surgery typically takes 3 to 4 hours, depending on the procedures that they're having done. We typically keep people in the hospital overnight, let them go home the next day, and it's usually 3 or 4 months before we can get someone on the surgery schedule.
Okay, sounds good. Thank you so much.
Thank you.
Okay.